Hello everyone, my name is Bunny. After a last year, I will study master degree about chemical. Today I have an interesting topic want to share for you. Intermittent fasting compared with traditional dieting. Weight loss is almost a big problem that everyone has been experiencing throughout their lives. People who want to lose weight are willing to try many different weight reduction methods. But most people now want to lose weight because they think they are not healthy, but they don't have time to go to the gym. Why is intermittent fasting? Is it better than traditional dieting? Long-lasting weight loss helps prevent diabetes, heart disease, and cancers, improve brain health, and strong physical fitness. According to this video, it can introduce what is intermittent fasting.
Fasting? Do you mean not eating? What about my metabolism? What about breakfast? What about the bacon? There's a negative stigma associated with not eating in today's culture that's surprisingly 70s. That's why today on The Health Nerd, we're going to discuss exactly how intermittent fasting is healthy and show that not eating or fasting is not only safe, it can be quite practical and helpful to one's overall health. Some of the most important health benefits seem to be it's easier to lose weight. So how exactly do you intermittent fast? It's rather simple. It's just going for periods of time, not eating any calories. There are two main ways people do this. The first is Martin Berkhan's lean gains model, or the 16-8 method. This is where you do not eat for 16 hours in a day and spend the other 8 eating calories. Most commonly, people will skip breakfast and push their first meal back until noon, then eating 3 larger and healthy meals at around noon, 4 p.m., and 8 p.m. The second method was popularized by Brad Pilon and involves fasting 2 times a week for 24 hours. The most common way to do this is to stop eating at 5 p.m. and don't eat your next meal until 5 p.m. the next day. The 24-hour fasting method has particularly compelling evidence since most of the studies done are used with this model. How should you start? Go ahead and try a 24-hour fast.
According to this video, we can know intermittent fasting you can try for 2 ways. One is 6 to 8. It means you have 24 hours a day. You can eat the food in 8 hours. After 8 hours, you cannot eat food in 16 hours. Also, the second way is 5 to 2. It means you have 7 days a week. You can eat food in 5 days. After 5 days, you cannot eat any food in 2 days. And what is traditional dieting? Traditional dieting, it means do not eat any food, only drink water and no sugar drink. As we know, for weight loss, everyone needs to 70% of weight control and 30% on exercise. There are a lot of methods to lose weight, like 5 hours intermittent fasting. Most people can try it because it means you can eat food in 5 hours. After 5 hours, you cannot eat any food. The focus is on not how to reduce weight, it's which weight is suitable for you. But the best time to eat or to fast is still being studied now. I have 3 main points to talk. Intermittent fasting is better than traditional dieting. First, if you use these 2 ways after 3 months, is totally different. The fat and muscle mass and effective of these 2 methods. Both these 2 ways can control diabetes or affect insulin secretion. The green color means traditional dieting, yellow is intermittent fasting. This picture is scientists, they test 16 weeks. We can know if you use traditional if you use traditional dieting, you can know your muscle mass is your muscle mass is you lost fat almost comes from your muscle mass. And if you use intermediate fasting, you can lose your fat more. So if you want to lose your fat, you need to choose intermediate fasting is better. Success is never certain, fail is never final. Because some people, they try traditional dieting in the beginning, they can lose their weight very quickly. And they think this way is good. But sometimes I think you need to think, because you can lose your weight very quickly in 1 month. It means it is not a good way to help you to lose your weight. The second one is basal metabolism. Insulin increase during starvation and carbohydrates and caffeine. When we are hungry, our body will secrete insulin. If you want to lose your weight, you cannot always be hungry, because here is concentration of insulin secretion. If your insulin secretion is higher, and your fat decomposition rate will be lower. So, because you want to lose weight, so your fat decomposition rate is higher. So, your insulin concentration needs to be lower. So, we can know traditional dieting is not a good way, because traditional dieting will make you always hungry, and your insulin concentration will be always higher. The third main point is fat. Almost all of us have two fats. One is subcutaneous fat. One is visceral fat. Visceral fat is inside subcutaneous fat. It means subcutaneous fat is all of your body that you can visible your fat is all of subcutaneous fat. You want to lose your weight, we need to lose visceral fat, because if you just lose subcutaneous fat, when you eat, all fat will come back very soon. So traditional dieting, you can't use this way for a long time. So you lose weight is subcutaneous fat. And intermediate fasting, you have enough energy to can maintain your body function. So you can lose visceral fat. So in conclusion, there are many ways to lose weight, but the best way is diet control and plus exercise. I think intermediate fasting is better than traditional dieting. A lot of people said, just eat less and you can be thin. I think this is right, but body basal metabolism will be low. You need to eat less and less one day by one day. If you want to lose your weight, you need to eat calories need to more than basal metabolism every day. So I will say intermediate fasting is better than traditional dieting, because intermediate fasting you can use for a long time, and it also can maintain your basal metabolism, and it is effective for reduce visceral fat. Thank you for listening my presentation.
Right, Jing?
Thank you, Bonnie. I think it's very interesting topic. But you've got some words, right?
Oh, because I remember I changed for the picture. Maybe I forgot to send.
Oh, yeah. And I think the photos, you have some pictures, they are the Chinese words.
Oh, because I found a
so
Chinese.
This is old one, right?
Yeah. No, because I cannot. This is picture, so I cannot.
Transfer.
I can.
Change.
I cannot.
Put the English on the
Yeah.
picture,
So I
right?
put English in here.
It's supposed
Yeah,
to say meaning.
Yes.
Because you have, I think we have to think about our audience. So
Maybe you can do this. Use
the
exercise.
Exercise. Yeah, that's what I wrote down too.
It's very
Yeah.
easy.
Recreate it.
Yeah.
And then you can put your own labels, make them bigger. Because also it's a little bit blurry too, because I think it was a small picture and you had to enlarge it.
Okay.
So a little small.
If you need, I can show you.
Yeah.
Okay.
the 10, I don't know the first, second, fourth, please. Fourth slide. Fourth slide. Fourth.
Up one?
Fourth slide.
Yeah, up one.
Up, yeah, up one.
Hmm.
Please up. Yeah, I don't know what's that being kind. I
Time.
mean, this title
Oh,
maybe
it
is
means-
not connect.
Because in the beginning, these two words can make you be thinner, but after 3 months, the effective is totally different.
I think you need to explain the title, why this use these words, yeah.
And
Because we are not clear.
is this your thesis slide? Or these are just, this is just information, or is this your thesis and your main points?
This is my main point 1.
Oh, it's just for your main point one. Where is your slide that has your thesis and your main points?
Thesis.
Yeah,
I said,
because you should have a slide that has your thesis that intermittent fasting is superior to traditional fasting for the 3 reasons, and then have your 3 points on there. Because I actually thought before that this was your slide, and I was going to ask about the time too. But you also don't need bullet points and numbers. Usually you have one or the other. And you would only have numbers if it was like in an order, but these really aren't in an order. It's just 3 different points.
okay.
Also, where's your counter argument and refutation?
I said a lot of people said, just eat less and less, you can be thin.
Okay.
It's my counter argument because
So who said that though? So we need some research, just a little bit of research, and we need a slide for it too. And also for the refutation, so for both of those. So needing more research to support your points. You didn't really have a lot of, like, any quotes really, I don't think, except for the one that was just about success never being final. Let's see. And also your chart, it seems like it's the opposite. If you go down one, the fat and muscle mass, when you were struggling to explain it a little bit, and I was reading your chart, and it says that by intermittent fasting, it actually looks like you lose less fat.
it's okay because I think I changed this photo. And
Okay.
This is old one,
Okay. All right.
but
It was like opposite of what you were saying. All right. And then don't forget your major transitions. Use like mostly step by step, like first, second, third. Try to have longer transitions so we know you're moving to the next point.
okay.
All right. Good. Thank you. And pronunciation, intermittent. Intermittent is a hard one. Intermittent. It's a hard word. Intermittent.
Intermittent.
So we have to work on that one. And then visceral fat.
Visual fat.
Yeah, it's another hard word. Visceral and subcutaneous.
Subcutaneous.
Yeah.
Continuous.
Subcutaneous.
Do you want to explain my vocab, like, or
If
it's
your
going to be
audience doesn't
all
know.
of them's different. I don't know if maybe anyone knows about.
Well, yeah, if your audience doesn't know, you should probably tell them, like, which is, and you can just do it quickly, like,
I can. Yeah.